There were 5 objectives: empower individual Londoners and their community. I taught the language of empowerment. Improve access to London's health and social care. Now, are you concentrating? Are you focused? This is the most important elected Conservative politician in Britain after the Prime Minister. In fact, he'd like to be the Prime Minister, but that's enough. After the Prime Minister, are you ready for objective number 3? Concentrating. Wow. Does anyone in this room think that what the US most needs to improve the health of its population is bigger income inequalities? Absolutely not. Are you saying it daily? Are you out there saying it daily to improve the health of the population, not for any other reason? I get asked, is anyone taking this seriously? A survey published this past week came across my desk on Thursday, looking at 65 local authorities in England and asked what were their #1 priorities for health and well-being. 49 said Marmot principles. In fact, I met one local councillor, local government official, not health official, from Manchester in the north, and she said, "Oh, you're a person. I didn't realize Marmot was a person." We talk about implementing Marmot. So we've got through. People are doing it. Those 6 principles that I read out, it's being applied. And it's not just England. In the Swedish city of Malmö, they set up a commission in the wake of the Global Commission. They published this year, in March 2013. Cities all across Sweden, in Norway, in Denmark, in Slovenia, in other parts of Europe, are taking what we've been saying on social determinants of health and putting it into practical policy. We've even got the doctors involved. Can you imagine that? We've got the doctors involved. We produced this report on working for health equity, the role of health professionals. I won't go through this now, but we laid it out and you can look at it. And outside Europe, my colleague Mirai Chatterjee, who's to the right of the Indian Prime Minister, Manmohan Singh, actually she's a good deal to the left of the Indian Prime Minister, but it depends how you look at it, tells me that national policy in India, it's as if they've been going through the Commission's recommendations one by one and implementing them. Costa Rica, in Lima, in Peru, concerted action, and in other parts of Latin America, Brazil and Chile have been the leaders in implementing policies on social determinants. And then our European review that we published last Wednesday. We said that health inequities persist within and between countries. Life expectancy in the Russian Federation is 17 years shorter than the best in Europe. Life expectancy at 63 is the same as for men in India. 1/3 of the Indian population live on $1.25 a day or less, and no one in Russia is living on $1.25, and they're not dying of malaria or communicable disease. They're dying of heart disease and violent deaths and other alcohol-related deaths. 17-year gap. And within each of these countries, we're documenting increasing health inequalities. And we've said health inequities are unnecessary, avoidable, and unjust. This photo is of the indignados on the streets of Madrid. Youth unemployment in Spain is 52%. And unlike what some of our governments are telling us, that unemployment is a lifestyle choice, these young people are really angry. And I said when we launched our review on Wednesday that youth unemployment is a public health time bomb waiting to explode. It's urgent that young people not leave school onto the scrap heap. And what we said, because there are countries at very different levels of economic and social development, if you're doing very little, do something. If you're doing something in terms of social expenditures, action on social determinants, do more. And if you're Sweden, do it better. So there's something for everyone. I just wondered, as I had you all here, there might be a few clinicians in the room, if I could get some help with some medical conditions that I've developed. The first is that I'm optimistic all the time. I see evidence of progress. It just makes me really happy. And there must be some pills I could take for this condition. But we're on the winning team. We're really getting places. And the second, which is a condition I've developed, which perhaps is related to the first, is selective deafness. I don't hear cynicism. When people say, oh, it'll never happen, no, I don't hear it. It goes past. And the third is an embarrassing tendency of my eyes to water. We were having a commission meeting, and one of the commissioners, Pascal Makumbi, former Prime Minister of Mozambique, he said, I haven't felt so energized since my country got independence. And I developed this watery condition of the eyes. When Mirai Chatterjee, photo I showed you a moment ago, one of the leaders of the Self-Employed Women's Association, that is empowering the poorest, most marginal women in India and changing their lives for the better. I developed this watery condition of the eyes. I was lecturing in New Zealand, and a Maori woman said to me, what you said, did it include me? New Zealand's pretty British, and what you don't do in Britain is display emotion. And I was a bit overcome. And the audience was a bit embarrassed as they watched me struggling with my emotion. And finally, I said to this Maori woman, when I was in Thailand and the Thai children sang, we are all waves of the same sea. We are all stars of the same sky. It's time to learn to live as one. And I said, if what I said did not include you, then I'm not doing my job properly. You may not remember, but I do. When I had the privilege of addressing you 5 years ago, I quoted Martin Luther King and said we needed to dare to dream. When we published the report of the Commission on Social Determinants of Health, The Economist newspaper said that we had a quixotic commitment to equity. Quixotic commitment to equity. It was peculiarly appropriate because I'd promised myself, and I did, that I would read Don Quixote while we were doing the commission. Because if you know the story, Don Quixote wakes up and imagines himself to be a knight and rushes around trying to do chivalrous deeds, and everybody's laughing at him. And I thought the cap fits, or rather the tin helmet fits. And I said this to the Spanish Minister of Health. And he said, we need the idealism of Don Quixote the dreamer, but we need the pragmatism of Sancho Panza. So colleagues, join me with the idealism of Don Quixote the dreamer and the pragmatism, the pragmatic steps we need to take to achieve that dream. When we began the commission, I quoted Pablo Neruda, and let me finish by quoting him again and invite you to rise up with me against the organization of misery.